Having properly positioned x-rays for orthopedic surgery is so very important. I'm going to try to give you the tips and tools to get that done. First and foremost, though, is your safety. Please make sure that whoever is taking x-rays is using the proper personal protective equipment. So you should have gloves, thyroid shields, as well as lead gowns, and everyone in the area of exposed radiation should be wearing those pieces of equipment. I do not want to see any fingers in any x-rays. Now that we have protected the staff, it's very important that we actually provide safety measures for the patient. We highly recommend that you provide sedation when taking your orthopedic radiographs, because that will allow you to get the best possible position with the least amount of stress for both you and for your patient. So tools that can help you can be things like a rolled up towel, sandbags, or foam blocks. Troughs are a very useful tool to have in your radiology suite, depending on the size of your dog. They come in a variety of sizes. I provide you with this special calibration marker. You flip it for the left or the right, and this will allow me to make measurements before I come and do surgery on the pet to make sure that I have all the tools that I need. So this needs to be incorporated in any of your orthopedic x-rays. My advice would be to start using this and substitute this as your new radiology marker. And you can use it for all your x-rays so that you don't forget when you're taking your orthopedic films. The x-rays that I require for a TPLO are a flexed lateral, where the knee and the ankle are in a 90-90 degree position. It's very important that the leg is parallel to the surface of the table, and you want to make sure that the knee and the ankle are at the same level. So you may need to adjust the patient a little bit depending on their position to get that to happen. You have to make sure that you collimate your x-ray to include both the knee and the ankle, as well as your calibration marker. You will know that there is no rotation because the femoral condyles will perfectly overlap. If there is rotation, you'll see that there's a separation between those femoral condyles, and you should retake the x-ray so that they are in the right position. We will also need the corresponding view, which would be an anterior posterior view with the patient on the back, or to do a posterior anterior view with the patient on the sternum. I actually prefer the sternal view. I think that you'll have much more success getting the patient properly positioned. To do the sternal view, sometimes you need to use a rolled up towel to help support the other leg. Sometimes you even have to almost lift up the other leg so that that kneecap is aiming straight down on the x-ray table. Focus on where that kneecap is, and that will really help you position the patient well. You really only need to catch about halfway up the femur, and then you want to get past the ankle or the hock. When you're doing either your AP or PA view of the extended stifle, make sure that the leg is extended and parallel to the table. And you may need to rotate either the thigh or the ankle. Sometimes putting your hand on the thigh will help, especially with your AP view when your animal's on your back, keep that kneecap straight. How do you know that your AP or PA view is good? The kneecap will be centered right along the long axis of the bone, and the fibellas will be centered on each condyle. We also do require for TPLOs an extended VD pelvis view. I find that it's very useful to use a large trough for those dogs and have their butt sitting on the bottom of the table. When you take that x-ray, that not only is the pelvis and hips part of that film, but you get the entire knee. When you extend the hips, sometimes you need to internally rotate those legs to make sure that the kneecaps, again, are right in the center of your x-ray.